And so I'm very excited to be here today. I've been skimming the program, the papers, and jumping into some sessions to try to understand what I could offer. And so yesterday and today in the morning, I was tweaking my presentation to make sure that I could add something. And if nothing else, I just hope that at the end of my keynote, I give you some food for thought. And so I'm Tiago, and as Katia mentioned, I'm a professor at the University of Lisbon and a researcher at LASIG, and I lead the group that we call the Tech and People Lab, because we are focused a lot on this relationship between technology and people, where people come first. I'm also a visiting researcher at the Inclusive Design and Innovation Lab at Northumbria. And so our motto and the way we think about technology and people is that we design, build, and evaluate interactive technologies that address high-value social issues, such as accessible computing or pervasive healthcare or digital healthcare. And so my background, I'm an engineer, started focusing mostly on human-computer interaction, accessible computing. And so our focus in most of our work is close to people and trying to understand and try to design interactive technologies that fit their needs. And so we have a variety of projects that I won't go into detail in these ones, but just to tell you that I started most of my research 20 years ago on accessible computing, and I've been leaning to other areas, one of them, and probably the most prominent in the last few years, digital healthcare. And so we have a high social drive, and the goal is that we also want to do the blue skies research and aim for impact in 10 years, but we do that by trying to impact people's lives right now. And so we have prototypes, and just as examples, we have prototypes being used by blind people for more than 12 years now. We have prototypes being used by people with dementia and Parkinson, their families, and their clinicians for more than 4 years now. And a large share of our research is done in the wild. And so we are very user-driven, and this happens a lot in the formative steps of our research. So when we start trying to understand a context, a problem, trying to figure out how we can impact